What does it mean to you when one of your patients have been driven hours to get care, and when they got there, they only needed to be airlifted because it's too late? Do you feel like as a provider, we did the service for them that we're able to have these additional options? Or is it actually we need to innovate more? At the end of the day, the reality is we have plenty of resources. We can always improve. It's about connecting patients to the care they need at the moment they need the most. Inaccessibility is a real cost. And there are plenty of solutions out there. We have to be good at being resourceful to our patients. Let's talk about how we can be the best resources to the patient who needs us the most. Welcome to Provider's Edge, the podcast that helps healthcare entrepreneurs and innovators break down barriers and control their business, life, and future with valuable action steps. With me, your host, Sabrina Runbeck, a recovered clinician and a business deal catalyst. Let's rewrite the rules and create a positive social impact while increasing your profitability. Great to be at Vive again for another exciting conversation with Scott. And we're talking about, we have a lot of resources. However, getting access, that's not always the easy. What about those areas that people do have to drive hour, 2 hours, 3 hours before they can get a diagnostic test? Or when they go to the ER, they barely have any function. They have to be flown to shift somewhere else. And especially in critical conditions, that's life and death. And for me, I know this by doing cardiothoracic surgery. And we know if people really have a dissection, you need to capture that right away. And that's 50% mortality rate if it happens outside the hospital.
Right.
So tell us a little bit about your guys. What makes you so passionate and excited to focus on the gap that you guys have been discussing for all these years?
Yeah, well, thanks for the opportunity. You know, some of the high level statistics which help us drill down into our mission and our core of delivering and giving that member an informed decision on their health is, 6 in 10 people have a chronic condition. Mm-hmm. Over 12 million misdiagnoses happen every year in healthcare. And to your point, you look at rural America and, both health plans and providers are always concerned about care deserts, not having access to care. How do we enable that? So the Clinic by Cleveland Clinic delivers virtual second opinions through 2 business channels. One is direct to consumer. So any consumer out there can go and go to the Cleveland Clinic website and start their process of getting a virtual second opinion. We collect all their data. That data is shared with a specialist team. A specialist emerges in either video or written. We give them that virtual second opinion within days. The benefit to that and the real point of that is we deliver that virtual second opinion back to their primary care team or their specialist team where they're under care already today. And we also leave the case open for 30 days so they can come back with likely questions they have. They're full of anxiety. They've just received news that they're not too happy with and they want to take control of their health. That's one side of the business. The other side is the B2B side, where we are partnering with health plans and conveners and brokers and other emerging partners like you see in the room behind us at Vive, where they're trying to make an impact on chronic conditions as well. So we work with those plans where they are putting the benefit into their plans, whether it's their ASO group or whether it's their fully insured group or their own employees, to offer them this virtual second opinion benefit. And the same process happens for them. So the beauty is the platform and the process are the same. It's how do you access that? Either one through your employer or your plan, or one direct to consumer.
Right. It definitely seems like as we start hearing these additional options for a subspecialty, it's hard to get to them. And there's so much work get dumped into primary care, supposed to know how to sort out these things, but they barely have any time. Right?
That's
One of the last study I found is clinicians have on average 26 appointments.
Yeah.
If you're a regular 8-hour day, how are you going to see all those people?
Yeah.
And then even you have all the great support team, right? Screening, medication check, compliance. But how much do you have even after that visit? You still feel like, oh my God, I'm charting nonstop, right?
Right.
And then we're sending referrals out and getting all the closed loop communication. If the patient is gone to the hospital, do I even know what they discharge clients?
Right.
It's complex.
It's very.
So for you guys, it's about synchronize this better and then either giving to the employers, saying, hey, let's identify your sick patient, give them these resources. And when they need it, we have ways to serve them right away without waiting versus the people who are in these very rural areas, hard to get anywhere anyway.
That's right.
And even from, I work at a VA for 5 years.
Yes.
So the system is always send us patients, right? Then we have the options like they can go to local hospital when they have to drive all the way to the main hospital.
Yeah.
And in those similar scenarios of people who couldn't get to the main hospital, even from the private side, what do they have to do, right?
Yeah.
So what are some of the cases that you know of that you're just like, wow, this is why we do it?
Yeah, great question. And I think that's what's just great about, the vision of the Cleveland Clinic and the partnership between the clinic by Cleveland Clinic and Amwell is to really give access to, anyone who really needs it, whether it's direct to consumer or whether it's on the B2B side. So if you think about it, the effort is, most plans, it's not an all or none solution to bring on. We have the 3,500 specialists of the Cleveland Clinic across 550 subspecialties. So we have kind of a consultative approach where we are working with these plans to say, help us understand your data, right? Mm-hmm. There's a big savings figure out there per case, but the real important piece is understanding their data. So we typically work with our partners in 3 areas. Help us understand your diagnosis codes across the prevalence of the conditions and help us understand your net claims paid cost. And if we can get that information ingested, we work with that partner to say, let's look at the priorities of the conditions that are happening. You look at certain demographical areas of the United States. The Southeast, where I live in Florida, has some of the most prevalent cases of musculoskeletal. And if you just, and then you have the care deserts, again, in the panhandle throughout Alabama and throughout Louisiana and some of the other areas. So some of our partners in the Southeast are actually asking, let's focus on MSK. And MSK happens to be the highest cost. You have either a laminectomy or a fusion that's happening. So they want to attack some of those high cost conditions. In a situation like that, the clinic is delivering as much as $12,000 savings per case. And how does that factor into the member? Nearly 70% of the time, there is a treatment tweak to your current diagnosis. And that is a major impact. It could be medication related. It could be treatment related. It could be process related, whatever happens. 25% of the time, there is a major diagnosis change. And the plans and their provider networks need that help. And I think that's where we create that 3-legged stool of putting the member or the patient, giving them that informed decision in a seat of power with their provider and with their payer to have a say in their care. And that's where, that's kind of where healthcare wants to go.
Right. It's putting patient into the forefront and then also engaging the support group that they have, whether there's family and people who need to be in the conversation with them, because as we know, the aging population, half the time they don't remember anything, right? And then we know that by study, they only retain barely 50% without them.
Right.
So if there's not a very specific plan written connection, they already lost all those. So for the system itself to be able to do that on their behalf, giving them the power to say, hey, there's a better, maybe a copay that is not exactly in your main pharmacy, but there's a different way to get it that's cheaper.
That's right.
Versus we think this subspecialty will be great for you, and then this is how you can reach them, where it's automatically connected to their system, without, even for us, right? I think we are in healthcare. We should know better. But when we are sick and try to make those phone calls, it's also taking
That's right.
hours sometimes to even get to somewhere.
Yeah.
Right?
Well, let's talk about that for a minute because it really ties into the theme of Vive, right? A lot of a lot of AI that's out there, but I also think it's not one or the other. It's both. So, obviously the Cleveland Clinic is a leader in automation and technology and advancements. But we really, if you look at our process, we're using that white glove treatment where we're offering the ease of getting a second opinion that's handed off to a nurse care navigator where we're giving that patient a white glove treatment by talking to them, by allowing them to explain where have they been in their care path, how many different locations they've been. And we ask for that burden to be put on us. Let us go collect that data with your consent and let's get all this. And then we work through the process of putting that in front of our specialty care teams, having that specialist emerge. And we allow that patient to, through that whole process, whether it takes days or maybe a week, depending on the complexity of your condition, we allow that frequent communication back with a live nurse care manager. These people are already agitated. They're stressed. They're worried. So we don't want to lose, AI doesn't fix all that. So we need that good blend of kind of human assistance in addition to the technology to let us go put the case together so we can read that back out to them.
Right. At the end of the day, AI is just going to do probably 80-90%, but we need a human element because it's human to human relationship. It's not human to machine relationship.
That's right.
To build trust, that takes a great communication skill to have that warm, nurturing relationship, as well as sometimes we have to be firm as providers, as a clinician, to say, there's only two options. What do you really want out of life, right? How are we supporting you when you only have pros and cons for both?
That's right.
And to helping them really truly move forward. And if we only rely on technology, we couldn't. But it helps us with making some of these decisions, capture the holes and gaps, so we can move all in this cohesive way. Now, we also like to ask fun questions. So if we give you a magic wand, like a genie in a bottle, and grant you 3 wishes, what would you use for to further improve the mission that you guys are on now?
Yeah. For me and leading our go-to-market strategy, it's all about, really, in my opinion, and what I wish for is give me the opportunity to educate. We know these memberships, 20% of the membership is driving 80% of the medical cost. You can have multiple partners in this. We are, like I said, again, we are not an all or nothing solution in the market. If you have a, Cleveland Clinic, even though we have 3,500 specialists across 550 subspecialties, we see kind of 5 primary areas where we get engaged. And it's oncology, it's cardio, it's MSK, it's neuro, and it's urology. Let's sit down together and help me understand your data, seek to understand, then be understood of where we can help you, right? Again, 20% of the population is driving 80% of your medical care costs. We want to be you have multiple partnerships. Another area to that is we want to have access to those partnerships. So you have other cardio or you have other oncology partners out there. We fit as a wedge, as a point solution, as an advocacy and navigation solution within those existing partnerships you have today. So we do not wedge ourselves as an all or nothing. We can be part of a much bigger landscape of partners. And it's results based. I mean, this is, when you talk about how this is set up, we could, typically when you start out like that, you want to go on a per case basis. You're only paying for, it's only embedded in the member's benefit plan of what you're using. I would not recommend PM in that case because we want to identify that population and go after them with the plan leadership, with your provider network, and be able to help that out.
Awesome. So what I'm hearing is definitely speaking with some more data-driven and understand what the data means to you.
Yes. And
help these plans to then support with the specialties, the resources Cleveland Clinic have. So with the remote monitoring, telemedicine, all those resources you guys already built to create that true partnership.
That's right.
And as you guys move forward, then it's more just communication dialogue of understanding data and using data for what it meant to be, and not just, we have a lot of data.
It's not an either or.
Yeah.
It's and. We can be a part of that and help that population. And it's results-based. Most of our contracts are results-based contracts. And, but you need the data set first. You need to understand that population, and you need to understand where that health plan really needs the help for that condition management for the member.
So your main ask for everyone who's listening is really about having connection with the health plans who seek to be understood and having more connections into those partnerships. How would you say anything else that you have focused on that the audience can support you, or if they wanted to connect with you, what would be the best helpful conversation?
Yeah, you find the experience with the Cleveland Clinic and our entire resource team, just very involved. We want to work with you. We want to sit on the same side of the table. We don't know what your issues are, and oftentimes we help you discover you didn't know what you didn't know, right?
Yep.
And sometimes it's just inch by inch, it's a cinch. Let's take a small population that's creating the most visits, that's creating the most claims, that's creating the highest cost. And let's just go focus on that and look after 12, 16 months, what those results have yielded with that patient population. I mean, we are governed by NPS and patient and company satisfaction. The 3,500 specialists, what we know about the provider networks, for instance, they're shrinking. Years ago, there were thousands. Now there's a couple hundred. And then 10 years, I don't want to act like, I have the stats, but there will be just a few major providers with their extended networks reaching out, right? They're shrinking. Doctors and physicians and clinicians are leaving the practice to maybe go across the hallway into some of the AI. And we know that our population is aging, and they're unfortunately just getting sicker, and we need to be very proactive with that as a team.
Exactly. Yeah. And it seems like as you guys are leader, you guys are also able to assess some of these point solutions that we are also seeing in Vibe to say what would be best for you to embed versus we already have the solution, and then we can build out better together as you are connecting with these bigger plans.
That's right.
As the bridge of assessing and sourcing the most customizable person-centric care that you can possibly do.
That's right. And remember, we're global. So when you look at some of these organizations that are looking for help, I mean, they're looking to help serve their employees overseas where they maybe don't have the care over there like they do here. Give us that opportunity to help you with that opinion and where the proper care should be, what the diagnosis is, what it can, and where we can see those improvements. So we really are a global impact organization.
Yes. As we come to a conclusion, I'm sure there's plenty of ideas flowing out there, whether people wanted to partner with you from an organizational standpoint, point solution standpoint. What would be the best way for them to reach out to you?
The Clinic by Cleveland Clinic does a fantastic job of embedding ourselves into the healthcare environment across payers, providers, conveners, brokers. It's easy to find us, but we're easily accessible online and through our media channels.
Amazing. Thank you. We appreciate it about seeing this global change of support as to giving the power back to the patients and how they can leverage more care when it's hard to find.
Thank you very much for the opportunity.
Thank you for tuning in to Provider's Edge podcast. We hope you enjoy our latest episode and found the insights and tips helpful. We'd love to hear your feedback on the show and learn what topics you'd like us to cover in the future. So please take a moment to leave us a review on your favorite podcast platform and let us know what you think. Your feedback is essential to help us improve the show and provide you with the content you need to take your healthcare business to the next level. Thank you for your support, and we look forward to hearing from you soon.